Thanks for coming, everybody. First up, we have Mr. Jeff Milton, CEO of LaoLa.
All right. Can you hear me okay? So I'm going to come at it from the industry perspective. My company is actually a very rare company because we're a venture-backed company that does rare disease. If you have done anything in venture funding, anytime you mention something like rare disease, venture capitalists scatter like cockroaches. They don't want anything to do with it. So that's really what drives a lot of the competition, subsequently the innovation, and therefore the solution. So this bill that's introduced is taking a huge step in the right direction. So I want to tell you about a story. There's a disease called Foer. I don't know if anyone's familiar with Foer disease. It's a devastating, progressive neurodegenerative disease. And these are kids that are born, have very normal lives. They get to be early adults, and then they're diagnosed and they start a progressive neurodegenerative decline into a vegetative state, and they die. This is a rare disease. It's about 400 to 500 patients worldwide, many in the US. And there's no therapy, but there is a potential therapy. There is a drug company that developed this therapy, taken all the way through preclinical tests, all the way through to in large animals, into toxicology studies through non-human primates, and they got to the point where they had to make a decision for a clinical trial, and they tabled it. So this particular drug has been sitting essentially on a shelf, ready to be dosed in these patients 5 years ago, for 5 years. So kids have been diagnosed and died in that time. And this is really just a shot on goal. It may not be the one that actually works, but it's a shot on goal that has been missed. And so providing some way to move forward that this drug can be entered into the clinic in a way that can treat these kids is super important. But there's one hidden sort of subtle aspect of it that I've seen being in the industry that people don't see. And that is because the competitive landscape for this particular disease is so small, there actually has been very little to no investment in discovery efforts during that period of time. They've essentially, because there's this drug ready to go into the clinic, there's no early discovery work to follow it, and innovation has essentially stopped altogether. So what we're doing today is we're taking a huge leap forward, not only to move this drug into the clinic, but to also move science forward from the clinic perspective. And then to quote Julia Vitarello, who's a good friend of mine, to not treat these kids is unethical. That's all.
Thank you so much, Jeff. Next up, we have Jessica Klein and Foer of the Star Research Fund.
Good afternoon. I'm Jessica Klein-Folio, and I am the president and co-founder of STAR Foundation. What an honor it is for me to be with you here today, speaking in support of the Promising Pathways Act. To Senator Mike Braun and Kirsten Gillibrand, this legislation means so much to families like ours and the countless others who have felt forgotten and alone amidst a painful diagnosis. Like so many of you here today, our journey began when our son Ben was diagnosed with an ultra-orphan degenerative rare disease. Over time, our precious Ben will suffer from seizures that will ultimately lead to muscle deterioration, and Ben will pass into glory as a young adult. But I'm not here today to talk about our sadness. It was what we have been able to accomplish amidst our grief that we hope can instill a sense of purpose in you all here today. It is because of the Promising Pathways Act that we were able to inch closer to our goal, finding a treatment for our child. Having graduated from the Juilliard School in 2009, I immediately began singing professional opera. I even sang for the late Ruth Bader Ginsburg in 2010 at the Castleton Festival in Virginia. For me, my career was off to an amazing start. Little did I know my musical background would ultimately lead me on a road I never knew I would have to travel. When Ben was diagnosed with LaoLa disease in 2017, my journey as a professional opera singer came to an end. I parted ways with my management and essentially my career to tend to his endless needs. Perhaps making this worse, Ben was one of 8 known cases in the United States. And so my grief began, and it was profound. However, I decided not to succumb to this sadness. Rather, I felt the desire to be a shining beacon of how grief can manifest itself into an overwhelming example of love, kindness, and determination. Not only for those in my professional circles, but for our oldest son, Mikey. How could we show him that no matter what challenges you face in life, you can transform those circumstances into something powerful, meaningful, and selfless? Although I knew nothing about science or how to start a foundation, I lived in New York City and I had some pretty great connections. I was able to assemble a team of doctors in New York City. With their help, we have now partnered with the National Institutes of Health, Mayo Clinic, Stanford, Children's Hospital of Orange County, California, Yale, University of Paris, and the list goes on to 46 active researchers. Additionally, Star Foundation has now identified hundreds of patients throughout the world, and we are flying sick children into the National Institutes of Health. While there, they are receiving imaging, blood work, and care that they otherwise would not have access to. We are also pursuing many therapeutics, one of which is working in our mouse models. This drug is called miglustat. Although it's approved for Gaucher's disease, due to the unending red tape within the FDA, it would be years before Ben or any solid child would have access to this drug. Senator Braun, Senator Gillibrand, it's because of your efforts that patients in the community that I serve now have hope for the future. It's because of you that the voiceless now have a voice. It's because of you that the hopeless now have a hope. It's because of you that I will forever be inspired to continue the work that I am doing on behalf of the rare community. Thank you for being steadfast advocates and believing that no disease is too rare for viable research and treatment options. May this bill be welcomed with open eyes, open ears, and open hearts. Thank you.
Thank you, Jessica. Now we have Senator Mike Brown of Indiana.
Wow, what an inspiring story. Keep up the passion. We're going to get there. I got here a little over 5 years ago and come from the world of being an entrepreneur, solving problems, and it's frustrating in this business. Sometimes we need more of that. Things go so slowly. When I look at what's happened with PPA, I know it's frustrating, but it's actually moved quickly by standards here. And when you can get to 90 plus endorsements, I just asked what we had a year ago, roughly 26, when I couldn't even get a co-lead on a great idea because of the kind of entrenched status dealing with the FDA. Kirsten Gillibrand came on a year ago. So, and I started on this in 2019, just to give you a little perspective on the pace of things. Now we have 8 Democrats and 10 Republicans. So that has all of a sudden gone from, you wondered if it's ever going to move, to that point where it cascades. So what is it going to take? The system is built on things not working. It's hard to get stuff through, but this is a solid idea. There are thousands of diseases that fit into this category. That means the power is in the collective interest of everyone here, and we know that time is our main variable. So I'm actually leaving the institution at the end of the year. I'm not going to drop the passion of it, but I want to make sure we get it across the finish line this year. You with me on that? Even if that doesn't happen, this has gotten such a solid foundation, it makes perfect sense. It's been neglected by the entities out there, including government, that simply won't pay attention to a host of diseases that don't have enough critical mass. One of the ways we explain this is I think when we start getting the original therapies that work, there's going to be an applicability across a broad array. I think we're going to have that to work with. And then sooner or later, you're going to get to the point where ideally, if this has cross benefit, it's going to be easier to get the folks in pharma to actually pay more attention to it. So we need to, this year, get 2.0 hitting the marketplace legislatively, which it will in what, a week to 10 days? And we've gone through all the reasons why the status quo doesn't want it to work, and we've addressed it in a common sense way that's going to give us the essence, I think, of something that's going to work. That's just part of the way that process works here. So it's going to be key for everyone who's endorsed here to get to each of your senators and then apply that same type of effort and pressure for the 435 U.S. representatives. If we get this thing moving like I think it can cascade over the next few months, there's a chance that that'll send such a signal that you don't have the normal having to go to the other chamber to get it done, which could delay it. And even if that occurs, don't lose hope. This thing has gotten to a level that it is going to get across the finish line. It's just going to be for my team, my crew here, which has been wonderful. We've taken this when we couldn't even get anybody on the other side of the aisle to listen to it. The FDA was reflexively against it. And we've come so far. I know it seems like a long time, but stay strong, stay enthusiastic. I'm going to be there to see what we can do, which is unusual to get it done this quickly, but we will get it done sooner or later. Count on that. Thank you so much.